Well, this is a really great opportunity for a multidisciplinary team that looks after colorectal cancer to meet and discuss new ideas. It's great to have a specific meeting for colorectal diseases, and there's a really interesting program arranged about updates in biological and surgical new knowledge in colorectal cancer. So I'm really grateful to be invited along to discuss some of the medical oncology advances that have been made in the last few years and how these relate to changes in surgical practice as well. Yeah, so we have published the Foxtrot-1 trial data in the last 2 years. And this, along with a number of other trials in the neoadjuvant setting in colorectal cancer, has shown that there is a new role for systemic therapy in the preoperative space. We need to work with surgeons to understand how to safely deliver that in a multidisciplinary team environment. And also, I'm looking forward to demonstrating how we are going to be using this approach to drive further improvements in future. Yeah, well, it's essential really, because there's nothing that we can do in terms of advancements without the help of industry as well as public bodies. We in medical oncology obviously work very closely with pharmacological companies to advance medical therapies, and it's great to discuss the surgical advances that have been made in recent years as well at this meeting with the companies that are represented. Well, it's a really exciting field. There's a lot of changes. It's very dynamic. We're making progress all the time. I think both for people considering surgery and for those considering medical or radiation oncology, but also for pathologists as well. Then there is a lot to be learned from meetings like this, and I'd also encourage people to come along to the European Society of Medical Oncology GI meeting as well, which will be in the summer, and I'm really keen to talk to students who are interested. We've recently finished recruiting to a trial of neoadjuvant immunotherapy in deficient mismatch repair rectal cancer, and the first patient that I had on that trial, who had a complete clinical response to treatment and was able to go onto a non-operative organ preservation pathway, that was a real career highlight to experience that. I hope that we'll get many more patients along that pathway in future.